Diagnostic ultrasound of the subscapularis muscle. First, we can start off looking at the anatomy of the subscapularis. So the origin is the subscapular fossa of the scapula. The insertion is at the lesser tubercle of the humerus. The actions are internal rotation and glenohumeral stabilization, and it is innervated by the upper and lower subscapular nerve. Positioning. I have the patient seated in an upright position with their arm in neutral, so that way we can later move it and see some dynamic imaging. Then the examiner orients themselves to view the screen and their patient at the same time. And then I also have the transducer notch facing towards the patient's right side and transverse in this case, just so that way what I see on my left is the same thing that comes up on the left side of the screen. Ultrasound gel was applied to the patient before beginning, and I have the patient started in a neutral position. And so as you can see, we have the reflective area in the bottom left of the screen is the humeral head, and then the tendon is the hyperechoic area above the humeral head. And as you have the patient externally rotate their arm, you can see the subscapularis tendon stretching. Here are some screenshots from the imaging we had in the prior slide. So down here in the bottom left corner, you can see the humeral head, and this is that reflective area right here. And then above that is the subscapularis tendon. So here we can see it in that neutral arm position, circled in blue, and then circled in blue over here, we can see it on the stretch. So this is when the patient was externally rotating their arm. Clinical significance. This can be used to identify tears in the subscapularis tendon, and it also allows us to view the subscapularis in a dynamic motion. And this also helps to view full thickness tears as they're easier to identify.